I don't want another pandemic either, which is why I think it's important that we know what's in our backyard.
It's the news Dr. Michael Letko doesn't want to deliver: the discovery of a virus with pandemic potential.
It's maybe one mutation away, and not much would take for it to be able to use the human receptor.
Dr. Letko and his team at Washington State University have been examining a group of coronaviruses related to Middle East Respiratory Syndrome, also known as MERS. Published in the latest edition of scientific journal Nature, his paper shows the virus known as HKU5 is mutating at an alarming rate.
I think our work is unique in that, there are not that many groups really trying to screen all the world's viruses to understand which ones are going to be a problem. But what we're seeing now are these concerning reports of new HKU5 viral spillover events across Asia.
In a laboratory, Dr. Letko says he discovered that the HKU5 virus uses the same method of infection as SARS-CoV-2, which causes COVID-19.
It just uses it in a little bit more of a species-specific way, so the receptor in our lungs is not very compatible with this virus.
Dr. Letko says the virus originates in bats, but last year a separate study revealed HKU5 had crossed species when it was found in dead minks in parts of China.
I think that was really a surprise, was seeing that shift. And then, we maybe had an idea that was coming when we saw that it was being found in mink. You see that little early species transmission event, and then you're thinking, okay, well, if it can do that, what's to keep it from going further?
Is it possible then that a human has already been infected?
It might. I think without additional surveillance of the human population in the area, it's difficult to say.
The Interim Centre for Disease Control here in Australia is monitoring this new zoonotic pathogen as the centre monitors a number of pathogens and infectious diseases occurring around the world.
Australia's Chief Medical Officer is Michael Kidd. He says the federal government is being actively advised on the HKU5 virus.
If there are changes in the transmission of this particular virus, obviously we'll be alerting the people of Australia about that.
In January 2024, the Interim Centre for Disease Control was launched to prepare Australia for future outbreaks. It's expected to permanently be established in January 2026.
So at the moment we're monitoring what's happening with this particular new coronavirus. If it was of a significant concern, then that may indicate the need to activate the National Incidence Centre here in Australia and coordinate activities with the states and territories in responding to the virus.
He says states and territories would still ultimately decide on restrictions, like lockdowns, in a future pandemic.
Obviously, the powers which rest with states and territories and the powers which rest with the Commonwealth remain the same as they were in the early years of the COVID-19 pandemic. Decisions about what public health measures should be enacted at a national level or in an individual jurisdiction, these will be decisions which are made based on what's happening with a particular infectious agent, what transmission we're seeing, who's being affected, and what we know about the particular agent.
We certainly don't want to see anything happen in the next 6 months where we might have some of these important areas of capability being built, but not yet the connections and the clarity around who's doing what in a pandemic.
Leading epidemiologist Professor Catherine Bennett co-led an inquiry into the federal government's response to the COVID-19 pandemic. The report identified one of the main areas of concern was public trust in government decisions around restrictions.
Sitting outside government is really important. So it will be able to offer advice and then publish the advice with the evidence behind the advice, do things that we didn't quite see previously, but also building relationships with our researchers across the country so that we can really bring that technical advice in centrally and have a significant source of expertise that's then available to Australians.
Last week, she attended the Communicable Diseases and Immunisation Conference in Adelaide, where the Centre for Disease Control was a focus.
I think the CDC operating outside the tent is a really useful part of the transparency that I think will make it quite an impactful body as well.
She says the centre would enable Australia to better prepare for the next pandemic.
Doing scenario testing, looking at how we're set up across the country for pandemics, and doing that on a regular basis and reporting that back to governments.
For now, HKU5 hasn't been detected in humans, but Dr. Michael Letko believes it's worth working on a vaccine before that happens.
I think without further data, people are not really ready to get too concerned about it yet. You know, short of preparing and trying to include HKU5 viruses in the next universal vaccine design, I think is the smart way to go about it.